lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
With you on my mind. With you on my mind.
On my mind. Well, there's Nat King Cole, and this is Boomer Life on CIL 650. And on our minds today is, a conversation with our friends from NeuroKinetics Clinic in Vancouver. We're going to talk about the brain, and we're going to talk about pain and chronic pain, and get through a lot of stuff here today. It's always a pleasure to have this group back in the studio with us. Philippe Silvestre is the founder and president of NeuroKinetics Clinic in Vancouver on Granville Street. The clinic manager is Sonia Dale, and J.C. Gordon is Director of Liaison and Logistics with NeuroKinetics. Nice to see you all back in the studio again. Hello.
Hello.
Hey, good to be here.
Philippe, let's start with you because you're the guy with the big show coming up in September now. You're going to take on. Now, Sonia, are you going to go to England to participate in this ceremony?
You know what? I'm going to go wherever he goes.
Okay. Because Philippe has just recently, within the last few weeks, received a notification that he is about to be inducted into the International Academy of Aviation and Space Medicine in a ceremony at Oxford University in England this September. Congratulations.
Thank you.
So this goes back to your early days as a flight surgeon with the French Air Force and your orthodox Western medical background that, since leaving the Air Force and moving to Canada, has been integrated with a lot of thought and modalities of Eastern medicine, thus producing the Philippe Silvestre we know today, who is an individual who works in all forms of medicine to assist people with traumatic brain injuries, correct?
A little correct. Yeah, correct in general. In particular, I was trained in Eastern medicine by the end, straight after my Western medical curriculum.
Okay.
So it is very close. I began my career, I was already trained in both.
Okay. So here in Vancouver, though, which is really, in terms of the globe, it's the line that divides or perhaps integrates Eastern and Western medicine, isn't it?
This is why I chose Vancouver.
Yeah. Tell us about NeuroKinetics, JC. You're the new guy on this team. You've only been with them for about a 6-month term so far. What brought you to the firm, and what do you do?
Well, I was brought to the firm by being introduced by a former patient that I had, who was a patient of Dr. Philippe's. She introduced us in a dinner we had almost a year or so ago, and Philippe and I got to chatting about our vision for how people can be helped, what the potential for people is from a healthcare perspective, and we realized that, hey, we're on the same path here, and so it has been my honor and privilege to be involved with the clinic here to basically help patients, because the neurokinetics paradigm is completely different, Sterling, than the Western medical model, simply because of the amount of time that we spend with every patient and the involvement of each patient that we require in order for the results to be produced that we're able to achieve. So my role at the NeuroKinetics clinics is to basically help people who are coming to see us for the first time, who are not aware of how we work, and helping them through the process from when they first come in the door, through the treatment program, and then when they're finished with us. Because when we're finished with a treatment program with our patients, that's not the end of it. We still have an ongoing support with all of our patients to ensure that they are going to maintain that peak performance that we've moved them into from, in some cases, trauma and incapacitation when they initially come to see us.
Right. And Sonia Dale is the clinic manager, and as JC has just described his work around the clinic in terms of helping people move through the process, you are the person that most people, or certainly many people, speak to for the very first time when they call or email NeuroKinetics with a curiosity question or a request of some kind for assistance. Generally, you're the person that's going to either take that call or read that email.
That is right, yes. I take the initial, phone call or email. If I need to forward it on to support staff further, I do. But mainly it is the initial contact is through me. So any phone calls, emails, everything is done through me.
All right, now we're talking on this particular program. Last time around, we talked about dizziness and other brain issues.
Yes.
But this time we're going to talk about pain, specifically chronic pain and trauma issues. So when someone calls NeuroKinetics, suppose they're listening to the broadcast now and they find you three a fairly enjoyable bunch, and you know, the kind of people I could spend a little bit of time with, and oh boy, have I got this problem. So when they call you, do you request a description of the problem, or do you just let people talk on and ask questions later?
Well, I feel for the conversation. Some do call in. There's just a lot of confusion. They don't know how to describe their condition or describe their certain symptoms. So it's just basically I say as in me or support staff here in NeuroKinetics or with the patient calling in, we help identify and weed out the information that we do need to get.
Right.
And we need to get and receive on our end to help us better understand what they're going through, what they're suffering through. So just asking the correct questions, also leading to, what are you going through? How long has it been? What are your certain symptoms? Can you sleep? Simple things of can you sleep also
Right.
helps us.
Right.
Are there any sensitivities to light, to sound? Certain things like that, mainly that are jumping to my head right now.
Sure,
that I can
of course.
say, that help us better and identify certain things. Simple things as even driving. Some people can't concentrate at work. Some people can't drive.
Right.
Some people, cannot do certain activities they used to do. Right now, look at, we have beautiful weather outside. Some people honestly can't go outside and enjoy the beautiful weather.
Right.
They can't go biking. They can't go hiking.
Right.
They can't go swimming. So we want to help them get back and, restore their self and restore their brain and get them back going again.
Let's get the doctor involved here. Philippe, when we're talking about pain, and I mentioned chronic pain specifically, or intractable chronic pain, talk to us about the types of pain that you see and treat most at NeuroKinetics.
There's a tremendous amount of modality of pain. Unfortunately, we are a complex anatomy. We are complex beings, and pain can be even physically multiple origins and multiple expressions.
Okay.
It can go from burning pain, ramping pain, crawling pain, spasmodic pain, excruciating deep bone pain between quotes, and the way these pains can be explained and expressed is very, very multiple.
Right.
We have also more than physical pain. One can express and live with cognitive pain, which ties mostly with a painful processing, like a software in a computer,
Right.
which would be overheating the computer out of his own processing. We can experience
So
that.
cognitive difficulties then, right?
Cognitive pain.
Okay.
It's more than difficulty.
And how would we recognize cognitive pain?
It is not recognizable
Oh.
unless one knows what is a cognitive processing.
Okay.
So, and this is what is that explains why patients talking about their pain to doctors which cannot apprehend the concept of cognitive pain because they never been told about that.
Okay.
So it doesn't make anybody bad. It's just a lack of information and education.
Okay. So you have physical pain and cognitive pain. Are there other types as well?
Emotional pain.
Sure.
Of
Okay.
course.
Sure. Of course. Yeah.
Everybody unfortunately experiences that sometimes. But when it takes a great deal of extent and never goes down, that becomes incapacitating.
Right.
You have sleep-related pain as well, and also intellectual pain and experiencing pain during an executive process as well. For example, you rest, you relax, pain goes away.
Mm-hmm.
Now you begin to do something, you begin to organize and plan an activity, and pain will flare up. That is executive performance-related pain. So you can understand the multiple phases of what can be pain about.
And we mentioned earlier at the beginning that we were going to talk about pain and trauma issues. Dr. Philippe, does pain always come from a trauma or a traumatic event of some kind?
Not always. Not always. When we talk about trauma, it is normally understood that it would be a physical or an emotional trauma. Those are the essential modalities of trauma one knows.
Right.
But there are more ways to get traumatized. We can be cognitively traumatized. In a sense, we could be feeling burnt out is a cognitive trauma, for example.
Okay.
So working long hours and relentlessly, and all of a sudden finding ourselves in a place of the body gives up, everything flares up, sensitivities, etc., will reflect the cognitive trauma.
So identify the type of pain. If suppose now I'm a caregiver, my spouse is a boomer like me, and she's not in great shape, and I spend almost all day, every day, making sure she's okay. I clean the house, I make sure that there's food on the table, that she's looked after, gets her meds, and all of that stuff. And at the end of every day, I put her to bed, and I'm beat. I am absolutely beat. I've got no gas in the tank at all. Caregiver burnout is what that gets called sometimes.
Yes.
What kind of pain is that?
That would be a cognitive pain.
Interesting. Okay.
As a causation.
Because it happens with boomers
Yeah.
a fair bit, you know.
Yeah, and that is not well explained outside of neuroscience. It relates to brain physiology.
Okay. So, and when when Sonia takes a call from someone who is experiencing one of these types of pain, and do they usually compound? Is one sort of lead to another? Do they sort of
Yes.
they start piling on top of each other?
Absolutely, yes. And the pattern will vary depending on one's activities and one's terrain, one's terrain and one's ways to do things.
Okay, so Sonia, when you start, and you said that when you take these calls, you do ask a series of questions, including, are you sleeping okay?
Yes.
And just basic human questions like that. But you're able fairly quickly to put together the sort of, in your mind's eye, to see a picture of the sort of burden this person is carrying.
That's correct, yes. That's why we ask a series of questions we do. It's just to help us better understand what they're going through, the severity of it, and that point we also recommend that they do come in to the consultation stage, where they come into the actual physically to the clinic. Or if they're not able to, because as JC was saying, in our previous show before, he was saying a lot of our stuff, patients do come in, fly-in patients we have.
Sure.
We do a lot of stuff through Skype. So if
is
they're
that
not,
right?
yes. So if they're not
Interesting.
able to come in physically to our clinic, or they're, just not wanting to, or don't have the ability to walk up and say, hey, I'm not ready to come in physically yet to your clinic, to your office. I want to speak to someone. I'm desperate to speak to someone to seek help, but yet not willing to come in yet. We will help them. We will still speak to them through Skype.
Interesting stuff. So, also bring all the resources to bear when it comes to finding a way to help people, Philippe.
It does with my training in telemedicine. That's space medicine.
Oh, okay. So the space medicine training leads the good doctor to employ Skype and FaceTime if you're an Apple user.
Those are.
Sorry, it's very important, Sterling, as we work with our patients, not to violate any boundaries.
Sure.
Okay, so we work within the comfort zone of all of our patients, because this is a long journey that we're going to be with them. We're going to find out what the root causes is, deal with the root cause, and then provide them with a treatment program and the ongoing support well after that.
Okay, so again, it's not any kind of process that's going to happen lightly or quickly.
Absolutely not, Sterling. Simply because we're dealing with patients who have never had any answers in the Eastern or Western medical models. We are dealing with the incapacitations as a result of brain dysfunction, and that's where Dr. Philippe brings his brilliance into our program to move that brain dysfunction into function, which what we find time and time again eliminates the symptoms.
Interesting stuff. And that process is sometimes referred to as brain optimization. Yes?
It is.
Okay. Well, we'll find out exactly what the heck that means when we come back. We better take a break here, and we'll find out lots more about NeuroKinetics Clinic, which you can do, by the way, while we take the break at neurokinetics.com. And we'll find out a lot more about brain optimization after this quick timeout.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIAL. We're back. This is Boomer Life on CIAL 650.
I would dance and be merry. Life would be a ding-a-dairy if I only had a brain.
One of the better moments from The Wizard of Oz. If I only had a brain. As we continue here on Boomer Life, and our conversation today with our friends from NeuroKinetics Clinic in Vancouver is all about brain and brain issues. Specifically on the program today, we're talking about pain and trauma issues. Our guest in studio, Philippe Souvestre, is the founder and president of NeuroKinetics Clinic in Vancouver. Sonia Dale is the clinic manager. And the new guy on the team is J.C. Gordon, who's Director of Liaison and Logistics, all three in studio this time. And what a terrific inclusion of Dwayne for the program, Philippe. A great example of the process that a patient goes through. And again, Sonia, I think a good example of someone who calls NeuroKinetics, who they've had it. They've had the biscuit. They're at the end of their tether. They've seen too many other people. They've received limited, if any, satisfaction. They're going crazy. And I don't mean that lightly. In many cases, they actually feel that they're kind of losing it.
Yes, that's right. It's having the burden of not having the right answers or having the unclarity. So that's what makes them feel a certain way. They've had so many other places they've been through where they've just said, you know what, hands up in the air and said, there's no answers.
Right.
So, that's what makes them feel a certain way, which is normal feeling for them to feel that way when you have closed doors in your face.
Absolutely. And Philippe, why is it that so many people suffering from these extreme pain processes, why can't they get adequate pain relief elsewhere?
I think it ties with the evolution of neuroscience and the evolution of medicine in general. There is a lot of new changes in mindset through the past 10 years, which have been evolving favorably into the medical milieu. There are still a lot of resistance, unfortunately, about that, but I can see now a change overall with the new generation of doctors coming in.
Oh, okay. Yeah. So there's more acceptance of non-traditional types of pain by the younger generation of docs.
You could say that.
Okay.
An example, typical example a little bit here of context would be, for example, what was traditionally called or classically called 30, 40 years ago like complementary and alternative medicine,
yes,
now is changing into what is called functional medicine.
Right, and when they were calling it alternative medicine 30 years ago, they weren't saying it in a complimentary way either. It was kind of, they were looking down their noses at it. And that, you're absolutely right, does represent a change because there's a lot more acceptance of that now, isn't there?
And this is, it is an open gate to integration.
Right.
Definitely.
Right.
Yeah.
So in terms of pain relief, though, when people come and call poor Sonia on the phone and just come absolutely unglued because they've had such difficulty being taken seriously in some cases that finally when someone offers a sympathetic ear and asks really good questions, a lot of people react emotionally, don't they?
Yeah.
They do, yes.
I actually had, Sterling, I had somebody call us the other day, and she had suffered pain for over 8 years. She had had no relief whatsoever. And I spoke to her for about 20 minutes' time, and she started breaking down and crying.
Right.
And she was, for the first time in 8 years, she says, I am now hopeful that I don't have to live with my pain anymore.
Right.
The burdens, the change in life, the change in friends and in lifestyle, pain can be a debilitating aspect for anybody's life.
And it can also be very isolating. I mean, I know a woman who lives in her home, and she has so much pain in her knees, she can't go up and down the stairs to answer her front door. She's a prisoner in her own house. She can't get out.
Yes.
She physically cannot walk down the steps to leave her house. This is pretty common, Philippe. This
Yes,
is not rare stuff anymore, is
no,
it?
this is the real world,
Yeah.
unfortunately.
So
Yes.
when and I wrote down the types of pain that you identified at the beginning of the program. You talked about physical, cognitive, emotional, and intellectual pain. And sometimes, as I also asked, they can sort of compound and pile on top of each other, which can generally, or which I'm sure leads to even more stress, if nothing else, and I'm sure more than a little anxiety in a person's life. So square that circle for us. How does it all work out?
Well, you just did it. You just did it, Sterling. There is a sequence, there is a cascade of chain of event that takes place when one begins to feel pain on a chronic fashion. The difference between acute pain and chronic pain is 6-month timeline.
Okay.
Whatever the pain is, it is expected that that pain, whatever it is, physical, emotional, or cognitive, or else, is supposed to be fading out of normal regulatory compensatory mechanisms which we are gifted with normally.
Right. Our healing systems.
Exactly.
Right.
Yeah. Whether mental or physical.
Right. Sure.
If there is something which is insufficient, either way or anywhere in these very subtle mechanisms organization, then we'll begin to get into chronic fashion, a chronic modality of whatever symptom, including here pain, as today's theme is about pain. And it is just a matter of time to go from acute pain, overlooked, to chronic pain.
I wanted to ask you about a timeline because last month when we were talking about dizziness and balance and those issues, and you at the time said, look, if you experience this kind of these symptoms in an ongoing way for any more than 6 months, you really need to seek professional help. Is 6 months the guideline for chronic pain as well, Dr. Philippe, or is there a different timeline dealing with it beyond which you really just need to go see somebody?
Well, 6 months is a good timeline.
Okay.
To keep it simple.
Okay.
Yes.
6 months.
6 months.
But, 6 months is a lifetime, JC, when you're living with chronic pain. It's just there's not a minute of fun in there.
Absolutely. Absolutely. And this is what I hear time and time again, Sterling, when people call us up, that they have been through the system. They've seen specialist after specialist.
Right.
They've been in the little box of expertise of a particular specialist that hasn't been able to help. And when they understand the NeuroKinetics model, that we're dealing with the root cause of this problem, which is in the brain, and we're able to optimize the brain. We're able to eliminate the dysfunction and turn it into function, and the pain disappears. Mm-hmm. This is a light that's been opened up to many of these patients that they've never seen before.
Yeah. I'm curious, to Dr. Philippe, as to how you do what JC has just described. When you take a person who's suffering from chronic pain, and you talk, JC, about root causes, for example, how do you get to what caused that chronic pain in the first place? Because that's where you have to go to start unraveling the story, right?
Yes. And we have a very effective assessment protocol, which is a 3-step protocol. One step being totally insufficient as with respect to this type of intractable condition.
Right. Okay.
Yeah.
So we'll talk about it. We'll take a quick break here, and because I wanted to, when we talk about the process, I wanted to be able to describe it from start to finish. So let's take a break a couple of minutes early here, and when we come back, our guests from NeuroKinetics will talk about how you can be integrated into their programs to your benefit. Enormous benefit, I hasten to add. This is Boomer Life on CIL 650, and we're right back after this.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIL 650. Back. This is Boomer Life on CIL 650.
Well, Sonia really likes that one, that's for sure.
I do.
Change my mind. We're talking with our friends from NeuroKinetics. Sonia Dale is the clinic manager down there. Philippe Silvestre is the founder and president of NeuroKinetics in Vancouver. J.C. Gordon is director of liaison and logistics with NeuroKinetics, which, by the way, is in the Highcroft Medical Building on Granville Street at 3195 Granville, and online anytime at neurokinetics.com. NeuroKinetics.com. We're talking about pain issues. And Dr. Philippe, I'd like to follow up on one thing that we talked about. I mentioned just briefly in a question form, the relationship between pain, chronic pain, and anxiety and fear. Because I suspect there's a little more to it than meets the eye initially, right?
Yes, it is the result of a process. Time is everything towards recovery, or also time is everything towards deterioration.
Right.
And the whole thing spreads like an old stain, if you will. It will be pernicious, it will be rampant, but at the end of the day, when this overwhelming pain will end up in crashing basically pain controls out of lack of cognitive processing, which is exhausted in the process in dealing with that very pain.
Right.
People crash, patients crash, we crash.
And so you said that people actually, when they call up in fairly agitated emotional states,
Yes.
I mean, living with pain is no fun, especially when you've been living with it, as Philippe just mentioned, for a long period of time. The brain begins to compound anxieties and fears on top of the stress of the pain itself. And what do people tell you when they just try to describe what life is like these days?
It's I would say the main thing common that I hear from most patients out there is a fear of dying with pain. So it's a fear.
Right.
It's a fear of how long, will I even get better? How long do I have to live with this pain? Is it ever going to go away?
Right.
So just answering the questions they have, giving them the clarity, giving them the relief, and knowing that there is hope at the end of the day. Just simple thing of picking up the phone, giving us a call, sending us an email for 30 minutes to 45 minutes just to, get the answers to certain questions they may have, to help them provide a little bit of clarity, to help them maybe give them a little bit of hope that, yes, maybe there's something that can be done.
Yeah.
That's all it takes.
And JC, that's the word. That's the operative word, isn't it? Is hope.
Absolutely.
A lot of these people who come to NeuroKinetics, boy, I'll tell you, they've seen a lot of doctors, they've seen a lot of medicine, and they haven't received a great deal of satisfaction in the process, and they're starting to run out of hope, frankly.
That's correct, Sterling. I hear it so often when I talk to people for the first time of, you mean I don't have to live the rest of my life with this pain?
Right.
And I answer that question for people by asking them the question, have you had pain your whole life? And if a person hasn't had pain their whole life, that is not genetically who they are.
Right, sure.
And so there's hope out there for you listeners. If you haven't had pain your whole life, you don't have to have it for the rest of your life either.
Let me use an example, because I'm just trying to relate to how this. Suppose I'm in a car accident and I get banged up and my back is sore and my neck is sore, and I've been to umpteen doctors and they've all told me they've had X-rays and CT scans, and I hurt all day, every day, and I have yet to meet a doctor in my experience since the car accident who has anything but, I mean, there's some sympathy, of course, but no ability to reach out to treat my pain. The prescriptions for mind-numbing painkillers, but no attempt to deal. So, Philippe, what do you do that's different from, say, a doctor who I would see I was in a car accident. I know you've convinced me by looking at the X-rays that I don't have a medical problem, but I'm in constant pain, doctor. I don't feel that I'm getting any better. So what do you do that the other doctors haven't been able to do?
The first thing I do, because I don't know what the others are doing, I can only talk about what I'm doing.
Okay.
And what I'm doing first is listening to the patient. The patient usually knows the best what they live with. And this is a very, very primary care I have, is gathering and collecting very, very precisely everything they tell me.
Okay.
Even in distress, there are data and cues in what the patient will report. Beyond some discrepancies, beyond some glitches, beyond some excesses, which are always in a picture, there is a way, and that has been part of my training as a forensic investigator, to go beyond the lines and read between the lines.
And we were talking, Sonia, earlier during the break that I mentioned that I was going to use a car accident victim as an example. And you said, that's a really good choice, because I talk to a lot of people who call NeuroKinetics who have been in accident, not necessarily car accidents, but some kind of traumatic accident type event from which they've never recovered.
Yes. Anywhere from sports to, car accidents to, now as weather is beautiful outside, people travel. A simple thing as even, bumping into something as they were traveling, or injuring themselves, running away because they're running to catch their flight as they're running late. Simple things of, fallen somewhere, caused some sort of pain, or has done something to trigger a previous pain that was never dealt with before.
Right.
I get a lot of patients that call me and said, you know what, I've had this when I was in the preteens, or I've had this as a child. I've never addressed it because they said, you know what, it'll go away.
Right, you'll grow out of it.
You'll grow out of it.
Right,
It'll go away. You're a child, you don't know, you're just growing pains. You know what, it'll go away. Guess what? It doesn't.
Right.
Then, they're in now their 40s, their 50s, 60s, even 80s and 90s. Where pain hasn't actually gone away. It's actually gotten worse.
Well, and sometimes, Philippe, it's that, speaking of an experience in one's youth, maybe it was that skiing accident when you were 20 that your knee never really completely recovered, but, somebody said, oh, you'll grow out of it eventually, and so you've just adapted. You've changed your life to accommodate that irregularity. People do it all the time.
I would like to add a little comment there, which is extremely important. You mentioned an accident that has occurred 20 years earlier, ski accident with a torn ligament on the left knee, for example, and a few issues on the lower back, blah, 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 without concussion, to take a simple case.
Right.
And what people say, as you say, is, yes, things will get better spontaneously, trust your physiology, ta-da-da, ta-da-da.
Right.
Well, it is ignoring what we increasingly know now in state-of-the-art brain physiology and related neurosciences, that after a given time, any peripheral ailment or symptom will become centralized and become a part of a brain's corrective strategy.
Oh. So your brain, so I was right. We change our lives to accommodate the injury and get on with it, because we need to get on with our lives. So that's what the brain is doing. The brain is just adjusting to include this new weirdness,
so
right?
Exactly.
Sometimes it does, sometimes it doesn't.
Okay.
There's always a good reason for why you wouldn't be able to do so. And this is what we assess and look for.
So part of the intake process, and Sonia, you've done a wonderful job of describing this in previous shows. There's that initial phone call or email or Skype moment, perhaps, followed by a first interview. And it's not an assessment, it's just an interview.
Yes.
You come in and you have a half hour to an hour long conversation with a team member, and your profile gets worked up. And then there are a series of 3 assessments. Talk about those.
We go on, from the consultation stage, we usually ask, I must go back and just say, we usually ask them to bring a family member or a friend, or someone they feel is very supportive.
Okay.
With them going ahead and seeking help. So from that point on forward, we go on to a level 1 assessment, which is going ahead and starting the testing period of time, which is for 1 hour, understanding the severity of the situation or the condition, which then moves on to the level 2, which...
And this is on a separate day,
yes.
right? There are three assessment programs, and they take place on 3 different days.
Yes.
They can be three sequential days, right? Like
yes.
Tuesday, Wednesday, Thursday, right?
We prefer to do it that way.
Okay.
Mind you, there are some patients, and I'm going to say this as well, 3 to 4 hours is a long period of time, and we understand that. There are some people that come in, they're drained by the end of it because, they're not well. We understand that.
Right, and it's quite demanding.
It is.
Right.
So what we can also do, and we're happy to do on our end, to be as, supportive and make it as comfortable as possible, we're happy to divide the assessments up.
Okay.
So meaning if we need to do... Yes.
Sure.
So if we need to do half of it one day and do the other half the next day, we're happy to do that so they're comfortable and they're not, feeling that the 4 hours by the time I'm there, I'm exhausted and I'm drained and I can't go home.
Right.
We're happy to do that for them as well.
Okay, and JC, this is all part of the customization that NeuroKinetics can arrange for each person as they come in with their specific issues.
100% correct, Sterling. Everybody have different issues. Everybody need a different program. Once we are able to determine that we can help them, what the intensity and duration of their treatment is going to be,
right,
they will have Dr. Philippe will customize an individual treatment program
right,
around their lifestyle that works best for them to move them from that incapacitation stage into the peak performance.
Right. It's all about possibilities, isn't it, Philippe?
Well, he ends up with a tangible restoration.
Exactly.
And performance.
A person back in the game again,
Yes.
right?
Yeah.
We all have, Sterling, we all have a limitless potential within us, and that's what we do at NeuroKinetics. We measure that potential, and we make it a reality.
All right. NeuroKinetics.com is the website. It's an excellent website, too.
Or renewme.ca.
Renewme.ca. Sonia's favorite back door into the corporate website is NeuroKinetics.com, or if you must, renewme.ca.
Yes.
NeuroKinetics, by the way, in Vancouver, and the Highcroft Medical Building right there at 3195 Granville Street, and of course online at NeuroKinetics.com, okay, and renewme.ca.
Thank you.
This is Boomer Life on CIL 650. Our thanks to Philippe Silvestre, to Sonia Dale, and JC Gordon from NeuroKinetics. And we'll see you next time right here on CIL 650.